With recent high-profile deaths by suicide, this is a time to stand together and resolve to do more. Suicide affects us all. We all face challenges and have mental health to manage. The CDC has released a report this week stating that suicide rates have increased more than 25% nationwide since 1999. The need for more research and a greater national investment in suicide prevention is clearer than ever. The American Foundation for Suicide Prevention is working diligently to prevent suicide. Chief Medical Officer of the American Foundation for Suicide Prevention, Dr. Christine Moutier, joins us today to discuss the increased rates of suicide in the United States. She's also helping us all to open up a dialogue about challenges people are facing. Doctor, what findings does the recently released CDC report show on the rising suicide rate?
Yes, the CDC released a report last week that shows what we've actually known for some time, that suicide is a leading yet largely preventable cause of death in our nation that has been on the rise, unfortunately, since 1999. It's been going up between 1% and 2% each year for a total of a 28% increase, which is obviously tragic and taking a major toll in terms of mortality, of taking premature life from our country and leaving lost survivors, and also really now it's, I think what's a very positive thing is that the report, along with these high-profile recent deaths, is raising a level of dialogue that is letting all of us know that this topic is important to talk about, that for anyone who is struggling, there is no shame in that, and that there are evidence-based steps we can take as a nation and as an average individual to reduce the suicide rate, to help prevent suicide.
Now, what is being done to reverse those rising rates?
A larger federal investment in the research that will help us to understand suicide and suicide prevention to the fullest extent that we need, like we've had that investment made, by the way, for other leading causes of death, including heart disease, various forms of cancer, and HIV/AIDS, and that investment did lead to changes and reductions in mortality rate due to those other health outcomes. So we know that that same thing can occur because while more complicated perhaps at this moment, as a nation we haven't been as well versed, and that's because the science is relatively newer as well, to show us that while complex, suicide is largely a health-related outcome. Of course it has other inputs in terms of the stresses that we face, past experiences from early childhood, our genetic loading, but that same type of combination of factors is true actually for almost every health outcome if you think about it.
And what steps can we take to help prevent suicide, and what are some of those warning signs?
Yes, so in our everyday lives and our homes, our communities, there are steps to take. And the first is really to understand that mental health is part of our health. Just like our physical health, it's dynamic. We have some conditions at times we need to take care of, and there are steps that we can take, certainly including medical or psychological treatment, but also steps that we can take ourselves that impact our mental health and can shore up and really set us up for the best outcomes in terms of our mental health. I don't think we've thought that way in terms of a prevention approach to actually preventing depression, anxiety, PTSD, or crisis. But we know that that can occur. So in your own life, I think one way to think of it too is that we can all be watching out for one another and really become better attuned to the changes in behavior that manifest as warning signs for suicide risk. And those can look like things like the person withdrawing from their usual interests and activities. Of course, that can be depression as well. But when they really begin to isolate, and especially if their tone and the way they're talking and behaving starts to hint at a level of hopelessness, anguish, desperation, particularly feeling like a burden to others. And that sense of isolation, by the way, can be very real in terms of being physically isolated from others, but more often than not, it's a perception of being isolated. And the thing to do if you notice any of those types of changes going on in your loved ones is to approach them and have a loving, caring conversation where you go out of your way to explain that you're there to support them and that it's not a moment of judging at all, and that you won't judge them for any challenge that they're facing. That will set up the best opportunity for them to disclose what's actually going on. And you can ask them if they're having suicidal thoughts, if you are seeing signs that are concerning like that. And that does not raise risk. In fact, it opens up the opportunity for them to share and for you to help lead them to professional help if indicated.
Okay, and where can we go for some more information?
Go to our website, afsp.org, to learn more, and particularly if you're thinking about engaging in this type of supportive conversation, we have a section on our website. It's called Talk Saves Lives, and it will actually help you know how to have that conversation. And if at any point along the way you need urgent help, either for yourself or for a loved one, you can reach out to the Suicide Prevention Lifeline at 1-800-273-TALK, or you can text, if that's a preferred way of communicating, to the crisis text line at 741-741. And there are trained counselors at both the National Suicide Prevention Lifeline as well as the crisis text line 24/7.
Okay, doctor, very important stuff today. Thank you so much.
Thank you.